Welcome to Lesson 3 of Module 1 in our course on dementia and Alzheimer's disease. Today, we'll explore the prevalence of Alzheimer's disease worldwide and its far-reaching social, economic, and healthcare impacts. Understanding the scope of this disease is critical for appreciating its challenges and the need for global action. Let's begin by looking at how widespread Alzheimer's is. Structured across 8 modules, Introduction to Dementia and Alzheimer's, Recognizing Early Signs of Cognitive Decline, the Diagnostic Process, Understanding Disease Progression, Treatment and Management Options, Caregiving Fundamentals, Advocating for Your Loved One, and Living Well with Dementia, this course provides an in-depth exploration of dementia, focusing on Alzheimer's disease, its biology, diagnosis, treatment, caregiving, and social implications. As of 2023, over 55 million people worldwide live with dementia, and since Alzheimer's accounts for 60 to 80% of cases, that translates to roughly 33 to 44 million individuals affected by Alzheimer's. The prevalence is highest among older adults, with the risk doubling every 5 years after age 65. For example, about 1 in 9 people aged 65 and older have Alzheimer's, and this rises sharply with age. Regionally, North America and Europe report the highest rates due to aging populations, but Alzheimer's is rapidly increasing in Asia and Africa as life expectancy grows. These numbers highlight the global scale of the disease. Let's now examine how prevalence is expected to change. The future of Alzheimer's is concerning. By 2050, the global number of people with dementia is projected to reach 139 million, nearly tripling current numbers. This surge is driven by aging populations and longer life expectancies, particularly in low and middle income countries. For instance, Sub-Saharan Africa is expected to see a 70% increase in cases by 2050 due to demographic shifts. These projections underscore the urgency of preparing healthcare systems and societies for this growing challenge. Next, we'll explore the economic burden of Alzheimer's. Alzheimer's and dementia carry a staggering economic cost, estimated at $1.3 trillion annually as of 2023. This includes direct costs like medical care and nursing homes, as well as indirect costs from informal caregiving by families. In high-income countries, formal care systems drive higher costs, while in low and middle income countries, families often bear the burden, leading to lost wages and productivity. For example, a family caregiver may reduce work hours to care for a loved one, impacting their income. This economic toll affects individuals, families, and entire economies. Now let's look at the social and healthcare challenges. Beyond economics, Alzheimer's has profound social and healthcare impacts. Socially, stigma around dementia can lead to isolation for both patients and families, reducing quality of life. For example, misunderstandings about Alzheimer's may cause friends to withdraw. In healthcare, access to diagnosis and treatment is limited, especially in low and middle income countries where there may be few specialists. Globally, there is a shortage of neurologists and geriatricians, making timely diagnosis challenging. Caregivers also face emotional exhaustion, physical health issues, and financial strain, particularly when balancing care with work. These challenges highlight the need for systemic support. Next, we'll discuss global responses to Alzheimer's. Globally, efforts are underway to address Alzheimer's. The World Health Organization's Global Action Plan on Dementia, launched in 2017, aims to improve awareness, enhance care access, and advance research by 2025. Some countries like the US and Japan have national dementia plans to coordinate care and research. Research funding is increasingly focused on early detection, new treatments, and prevention strategies, such as lifestyle interventions. These initiatives show promise, but gaps remain, especially in under-resourced regions. Let's now consider disparities in Alzheimer's impact. Alzheimer's impact varies across populations. Low and middle income countries face a higher burden due to limited healthcare infrastructure, making diagnosis and care scarce. Women are disproportionately affected, both as patients, due to longer life expectancy, and as caregivers, often juggling multiple responsibilities. Racial and ethnic disparities exist. For example, African Americans have higher rates of Alzheimer's, potentially due to socioeconomic factors and health inequities. Rural areas also face challenges with fewer specialists and resources compared to urban centers. Addressing these disparities is critical for equitable care. So let's summarize the key points. In summary, Alzheimer's is a global health crisis affecting over 33 million people today and projected to impact 139 million by 2050, particularly in low and middle income countries. Its $1.3 trillion cost reflects medical care and productivity losses. Socially, stigma and caregiver burden are major issues, while healthcare systems struggle with access and workforce shortages. Global efforts like the World Health Organization's plan are steps forward, but disparities by region, gender, and race highlight the need for targeted solutions. This sets the stage for our next lesson on myths and facts about Alzheimer's. Thank you for engaging with Lesson 3. In Lesson 4 of Module 1, we'll tackle myths and facts about Alzheimer's disease, addressing common misconceptions to foster better understanding and reduce stigma. For example, we'll explore whether Alzheimer's is just, quote, normal aging, unquote, or if it only affects the elderly. I look forward to seeing you in Lesson 4 as we continue exploring Alzheimer's and dementia.